NCLEX RN Exam Practice Test 2026 questions to simulate real conditions. Question 1. Which laboratory test result is most consistent with a diagnosis of chronic renal failure, CRF? Option A, increased pH with decreased hydrogen ions. Option B, increased serum levels of potassium, magnesium, and calcium. Option C, BUN 100 mg/dl and serum creatinine 6.5 mg/dl. Option D, uric acid analysis 3.5 mg/dl and PSP excretion 75%. The correct answer is option C, BUN 100 mg/dl and serum creatinine 6.5 mg/dl. CRF is characterized by the accumulation of nitrogenous waste, resulting in significantly elevated BUN and creatinine levels. Question 2. The nurse should provide which definition of dysplasia? Option A, a presence of undifferentiated tumor cells. Option B, increase in the number of normal cells. Option C, replacement of one cell type by another type. Option D, alteration in the size, shape, and organization of cells. The correct answer is option D, alteration in the size, shape, and organization of cells. Dysplasia refers to abnormal development or growth of cells, characterized by changes in size, shape, and appearance, often a precursor to cancer. Question 3. The nurse is caring for a 65-year-old male client with a history of ischemic heart disease who has been admitted to the ICU following a myocardial infarction. The client is currently receiving lidocaine IV to manage his ventricular ectopy. Which of the following factors would be most important for the nurse to consider in relation to the administration of this medication? Option A, decrease in arterial oxygen saturation, SAW2. Option B, increase in systemic blood pressure. Option C, presence of premature ventricular contractions, PVCs. Option D, observation of a widening QRS complex on the ECG. The correct answer is option D, observation of a widening QRS complex on the ECG. A widening QRS complex on an ECG can indicate lidocaine toxicity or significant conduction delay, which is a critical safety consideration during administration. Question 4. A 72-year-old male patient with a history of atrial fibrillation and controlled hypertension has been initiated on warfarin therapy. The patient has a recent history of a peptic ulcer. Which instruction should the nurse prioritize when providing discharge teaching? Option A, report incidents of diarrhea. Option B, avoid foods high in vitamin K. Option C, use a straight razor when shaving. Option D, monitor for signs of bleeding, such as bruising or black tarry stools. The correct answer is option D, monitor for signs of bleeding, such as bruising or black tarry stools. Warfarin increases the risk of bleeding. Given the history of peptic ulcers, monitoring for GI bleeds, black tarry stools, is the highest priority. Question 5. A nurse is preparing to insert an IV catheter for a 33-year-old patient who has a notably hairy forearm and is allergic to adhesives. How should the nurse manage excess hair at the intended catheter insertion site? Option A, leaving the hair intact. Option B, shaving the area. Option C, clipping the hair in the area. Option D, removing the hair with a depilatory. The correct answer is option C, clipping the hair in the area. Clipping hair is preferred over shaving to prevent microabrasions that increase the risk of infection at the insertion site. Question 6. A nurse is educating an elderly female patient diagnosed with osteoporosis who leads a sedentary lifestyle. Which complication should the nurse emphasize as the most significant risk? Option A, increased susceptibility to bone fractures. Option B, consequences of long-term estrogen deficiency. Option C, impact of sustained negative calcium balance. Option D, the progression of spinal deformities. The correct answer is option A, increased susceptibility to bone fractures. The most significant clinical consequence of osteoporosis is the risk of fractures occurring from minimal trauma or daily activities. Question 7. What should the nurse identify as the primary goal for women performing regular breast self-examination, BSE? Option A, to detect any cancerous lumps early. Option B, to identify areas of thickness or fullness. Option C, to notice any changes in the breast tissue from what is normal for each individual. Option D, to differentiate between fibrocystic masses and other lumps. The correct answer is option C. To notice any changes in the breast tissue from what is normal for each individual. The goal of BSE is for the individual to become familiar with their own normal so they can report any changes to a healthcare provider immediately. Question 8. A nurse is managing the care of a client diagnosed with hyperthyroidism reporting palpitations and weight loss. Which nursing intervention should be prioritized? Option A. Provide extra blankets to maintain warmth. Option B. A monitor for increased signs of restlessness, sweating, and weight loss. Option C. Encourage increased physical activity. Option D. Offer a low iodine diet and coordinate with a dietitian. The correct answer is option B. Monitor for increased signs of restlessness, sweating, and weight loss. Hyperthyroidism involves hypermetabolism. Monitoring for worsening symptoms like extreme restlessness or weight loss helps identify potential thyroid storm.